Thompson loves to play sports.
Pitcher, first baseman, plays basketball, runs cross country, plays golf. He's just all boy, just typical teenage boy. At a sports physical, the doctor said, he's got scoliosis.
Before we went in, Thompson's back looked kind of like a question mark.
And he was having some just terrible pain, just debilitating pain.
My back had never really hurt like that before.
His pain complaints seem to be out of proportion to what we typically see. And that's a red flag that something else is going on.
And they ordered an MRI, and that's when they found the tumor.
We operated on him and took out a large portion of his spinal cord tumor. It fortunately was a relatively low-grade type of tumor, which means that his prognosis is good. Spine tumor surgery is pretty intricate, and the primary goal for a child who doesn't have any true neurologic deficit is to make sure that they don't end up with a neurologic deficit as a result of the operation.
They went in and put those rods in and straightened his back out, and when he stood up for the first time after his surgery, he kept going and going and going. My brother says he went from a question mark to an exclamation point.
In the collaboration between the neurosurgery group and physical therapy and rehabilitation and orthopedic surgery and kind of the entire care team is a unique one, it's a special one.
Unique, I think, is really because of the combination of all the different caregivers.
We team up with the orthopedic surgeons a lot for their expertise, and they do the same for us.
The neurosurgeons who, when in this particular case, I don't have to go seeking out somebody with special skills because they're right around the corner.
We have a comprehensive inpatient rehabilitation unit. Learning how to walk in a different way, to know that your body's going to change, to have a different body position is quite different after spine surgery.
They work miracles up there on that third floor.
And the first time that I walked, I only took like 3, 4, 5 steps. But to them and to me, that was a big accomplishment.
His strength made it so that we were able to be strong. I just knew that he was going to be able to fight back. 13 days later, he walked out of the hospital and played baseball in the spring. It was a big triumph.
Let's go, Thompson!
Every child is the most precious thing to their parents. More than anything else, we try to really take care of the patient, and so teamwork is kind of the name of the game.
It is a special place.
As much as you don't want to be there with your child, to be at a place that loves your child as if they were theirs. In difficult times, it is a very comforting place to be.